Hi there, I'm Dr. Thomas Gerber, the Web and Social Media Editor at Mayo Clinic Proceedings. I'm also a Professor of Medicine and Radiology at the Mayo Clinic College of Medicine. And now I get to tell you about the Editor's Choice and Highlights articles in the March 2015 issue of Mayo Clinic Proceedings. Our Editor's Choice original article this month examines how the cost consciousness of U.S. physicians is affected by the care intensity in their training environment. The authors are Dr. Kira Riskina and colleagues from the University of Pennsylvania, the University of Michigan, and Mayo Clinic. Do residents who train in hospitals with a high care intensity index have higher or lower awareness of cost containment and high-value care? That's an interesting question about the so-called hidden curricula that are created by the practice norms at training institutions. One of the highlights in our March 2015 issue is the latest contribution to our symposium on pain management. In this article, Drs. Starling and Dodig from the Arizona campus of Mayo Clinic address best practices for chronic migraine patients, with particular emphasis on their management in primary care. Another highlight in this month's issue is a concise review for clinicians on emerging issues in gram-negative bacteria resistance, written by Dr. Sean Vesu and colleagues from Mayo Clinic. They address really important new concepts in the detection, treatment, and prevention of infections with multi-drug resistant gram-negative organisms, and they discuss emerging therapies and point out areas that are in dire need of further study. This particular article comes with up to 1 hour of CME credit if you complete the appropriate documentation. And our third highlight this month is another original article, this one written by Dr. Adil Ahmed and colleagues from Mayo Clinic. They examine the effects that adverse in-hospital events that ranged from inadequate empiric antimicrobial coverage to inappropriate tidal volume and mechanical ventilation have on in-hospital mortality and length of stay in patients who have or are at risk for acute respiratory distress syndrome or ARDS. As always, online access to these Editor's Choice and Highlights articles is free during the month of March 2015. For more information, please visit our Mayo Clinic Proceedings website. Also, why don't you friend us on Facebook, follow us on Twitter, and subscribe to our YouTube channel? While we're recording this in early February, there is still plenty of snow on the ground outside. It'll all be gone though, I hope, when we meet again in April. See you then.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.